It is a pleasure to meet you again in this webinar. And good morning, Professor James Arvanitakis. And also, how are you, Councillor Todd Diaz, sorry, and also Dr. Andreasta. Thank you very much for inviting me for sharing about how we adapt to the COVID. And I'm actually afraid of the title of this discussion, the fate of the university. That's very. Let me share my slide. Can you see it?
Yes, it is visible
Okay.
now.
Yeah, okay, thank you very much. So the pointers of the my presentation is actually about two things: how the faculty react to the COVID-19 pandemic, and also sharing about the adaptations that we pass through. And when, as we understand together that what already mentioned by Professor James, that COVID is not a change, but it is a big change that we cannot avoid. So we need to follow and face this change with strategic steps. So we believe that what we change is a process of like aligning people, resources, and culture. And we need a new plan. As we learned from one of the literature that showed us that we need to follow, at least this is one of the literature that I refer, that we need to create together about the sense of urgency. This is the first step. And then we reformulate the vision. We have to formulate the visions and also the strategy, and also communicate this new vision to the people, to the faculty, especially. And then we try to remove all the barriers, to enable actions of the whole community in the campus, and also keep monitoring and give evaluation in the short term, so we feel happy what we have already achieved. So not going frustrated with the perhaps not everlasting COVID pandemic. And then we try to consolidate change and also produce more wins for long-term plan and institute the change in the culture. So the first things that we try to identify and discuss with the people in the campus, with all the staff, is what is our points. So what is the challenge, opportunities, ideas, needs, and what is the next steps? And we found that there are at least several issues that we need to sort out, like we have to take care of the safety first. And we have to give support to everyone in campus and maintain connectedness among students and also the staff and also supporting staff. And we have to keep our learning process continue. At that time, we come to several scenarios. And also, we also thinking about the method of evaluation. And how about the research? How is the continuity to going to the field? And how is the supervision? And how to maintain the quality? And how to recruit the students and also the supporting staff? And issues of many innovation that we need to start to face the new challenge. So as we already discussed before, that we need to formulate new vision. So as early as, I think early April, So we have a very intensive discussion about the vision and mission that we need to change. So we need to reorient our faculty vision and mission. And we come up with this statement, which give us opportunity, yeah, that the COVID make us and force us to have more online, and this is give us opportunity. So we restate our vision to become an innovative and world-class faculty of medicine. So before we only come up with to become international, yeah, that's already being achieved, but now we want to become a world-class. And the mission is also emphasized of the use of data and knowledge using information technology and our academic health system. This is also one of our unique, yeah, mission, yeah, compared to the other university. And so the next stage, we develop a strategic response, of course, with the stakeholders, yeah, that is collaborate with us. So we define the short-term and the long-term strategy. The short-term strategy is what we call as the some innovations to survive. So here we develop plan and also teamwork, yeah, with the faculty or in the university level or with the region in the province, yeah. So we create a teamwork to solve several issues. So like for development of regulation, not only for the faculty, but also the university and also the region, and also develop teams to plan about scenarios for teaching and learning approach, because we have to move on, yeah. And also we have a team for develop plan for research and also for logistics, particularly for personal protective equipment. That is new things that we have to relocate our budget. And for the long-term strategy, we also have to need to design how is the tomorrow's business, yeah, in educations, and how we improve the quality of teaching learning that's already being initiated in the last 12 months, yeah, and then we try to improve it, and how we improve the infrastructures of for the new situations, yeah. So thanks God that we have the unique department, that is the Department of Medical Educations, that also help us a lot in creating the teaching, learning, and also the new situations of learning in the future. And the other thing, we have also to think about further innovation, like, for example, for the infrastructures and also the human resources, which is, I think, would be different from the current situations. So I'm going to share several activities what we have already adapted for in the faculty level. Like for the adaptations of the teaching for the large and small group teaching, we already moved from for the lecture with a synchronous and recorded lecture. With also we uploaded some required reading, yeah, and we already have also the learning platform, what we call it the GAML, yeah, learning management system. And for the tutorial, we also have several approach with synchronous online discussion and also independent study and asynchronous discussion. Yeah. Also for the practical session that before we think that it is not possible, but we found that video learning and also followed by assignment or quiz is also possible to overcome this problem. For skills training is a bit difficult. Yeah, we try to use the video learning and followed by practice at home and then submitted the recorded practice via Gamel, but that is not replacing the face-to-face session. Yeah. And so we did the evaluations, whether the students happy, the teachers happy with this approach. So we found that there are several strengths that is inflexible and also perhaps more relaxing, and no preparation to go to campus, of course, and more confidence to raise questions because it's yeah, look very near. Yeah, you discuss with someone that is very near, and then documented materials also can be learned later, and this is more I think more yeah, manageable. Yeah, manageable for them. And some area of improvement we found here that we have to reduce the assignment and also reduce the some students feel concentrations, too many distractions. More feedback and interactive session is needed. And also some students feel difficulties for the internet quota. And this is one of the inputs that also give us plan for giving subsidy for internet quota. And also area of improvement is schedule changes. So from that activities, we also have ideas for improvement. Like for example, strengthening asynchronous session, yeah, and how to strengthen the synchronous sessions. So some of ideas that now is already being listed, and now we work on that, yeah. And other ideas for improvement is also coming with the now we try to combine, yeah, non-virtual with tight COVID protocols, yeah, gradually. So this is also one of the blended learning that we proposed during COVID, yeah. We also here found that more videos should be produced, and also data analysis, yeah, of all the activities. And we now come up also with the ideas of gamification and also virtual reality-based simulation now is working on that. And that is because I think about 20% of our staff are perhaps younger generation, which is very literate with technology. Yeah, and so we try to relocate our activities and also budget by increasing the grant, yeah, educational grant, which actually we have already started since 2018, but in 2020 we increase it and give this give enthusiasm for more teachers. So more teachers are involved in this grant, and we also provide some like training, yeah, training for the teachers, yeah, 3 batches for e-learning. So more teachers know and being able to involve in this grant, educational grant. The other budget relocations, we try now to establish several studios. So one of which is now is the moderator is there, yeah, Mr. Marantika, and also the production house, yeah. We renovate the learning resources and innovation development unit, which we found that this is very important for the future. And some other is we also relocate some money for the logistic and internet quota for students, yeah, based on survey that I've already presented. And because not all students are lucky enough to support their internet quota. And the others, problem of distress, anxiety, as we found is increasing. And so we intensify our psychology service with the online service and consultation. And this is not only um, accessed by our students, but also from other faculty. Yeah. And also, although we are in the online approach, and usually students have many extracurricular activities, but students should still did lots of activities, and I think we learn from that. Yeah, we really supporting the students for this, and they from them we learn a lot. The other strategy is faculty from the hospital, with the hospital, which is Sajito Hospital, that is our main teaching hospital. We have a new joint decree, related with the COVID. And so we also have how the operational standard that's related to the COVID, especially for the clinical education. So as early as 2 weeks after the first case was announced in Indonesia, so we change and mix, our clinical educations, and we have the decree and also the joint decree. And we mix the clinical education with various activities like online case discussion, skills demonstrations, and also stimulate new ways of learning, like interactive case management using applications, and using lots of Zoom meeting, for case discussion, and then student demonstrate with his friend, roommate, family, and also procedural skills drilling. Yeah. So some of the activities are also using face-to-face. Yeah. And about the strategy with the university, faculty and the university, we are, I think the faculty is the backbone of the task force that was established by the university. And here we contribute for improving the health literacy. So we have, this is also promoted, initiated by the Faculty of Medicine. We already declared as the health promoting university since 2019. Yeah. And we also contribute in self-screening, hotline, and tracing in the university level, and come up also with lots of health technology innovation and research. Of course, this is not only by the faculty, but also with other faculties in the university. And we come up with many products for the research. Yeah. And also the policy on learning process that keep, I think, revised or adjusted, depend on the situations. One of the activities that I would like to share, we have what we call it as the community and family healthcare with interprofessional education, which was followed by the medical students. So since 23rd of March, students are actively partnering with their families, families to improve the the literacy, public literacy for COVID. And this is guided by the educational materials that is put in this website, HPUUGM ACED. This is one of our contribution to the community. Also, we provide some website under the HQ and also tropical medicine that can be accessed not only by the students but also by the public. And the other things, we also have experience, last July, for the way we recruit our students. This is when we have the interviews, yeah, for the incoming students. And also in orientation, yeah, a new online orientation suite, yeah, of the new students. This is all not only for the faculty but also in the university wide. The other things is the strategy that involving how the faculty contribute to the not only to the university but also to the government. So we also participate as the member in the province task force and actively contribute for establishing several policy, yeah, regarding the COVID. And also in health promotion, especially for advising for content and also training. And we have a large contribution for diagnostic laboratory in the province and also Central Java, yeah, for Jogja and Central Java, which we contribute the large number. And this is also unique because before our laboratory is only have two PCR RT, yeah. One is from the integrated laboratory from the university, and one is from the other lab from Tahia lab. But this become a big laboratory because we also receive several instruments from other from government and also from others, yeah. And so now becoming the large diagnostic laboratory for PCR RT in Jogja and Central Java, southern part. Yeah. And the other is contribution in hospital service and also in Sonjo, yeah, in Sonjo. So Sonjo means that we here, this is the what we call it, the community, yeah, the community network, yeah. So this is some of the event, yeah, that we discuss, yeah, for educating people. And this is what we call it, the Sonjo. This is the UGM initiation, yeah, for the network community that help people to overcome many problems, like for getting foods and also getting perhaps as a trader, they have reducing income, and also for hospital, for referring patients and looking for the plasma convalescence and etc. Yeah, many things is sort out with this community network with a very nice what you call it logo, ora ono senkeri, or no one left behind. Of course, during the 1 year, we also have some people. We also have some challenge. Yeah, some people reluctant to change. Yeah, and we understand that this resistance is now. I think the number is decreasing. Yeah, because people now is more realized that the COVID should take perhaps more time, yeah, for that. And so the faculty have to acknowledge about this, that some people perhaps need to more time, yeah, to change. But we have to be very careful not make people that coming to the depression. That when they have frustration, then we need to hurry up with some trial and error, some decision to uh, to make the new normal or new things happen. And we also started or focusing from change from the easiest, what we can control and what we can influence. Yeah, not so make everything more doable. Yeah, not only a dream, and also adjust the change according what we face, the people, because we know that the people we face or the working team or the unit under the faculty with different culture. Yeah, so we have to think about this culture dimension. So it is, we learn a lot. It is a complex, and we found that educational organizations have to change. It is not a political arena that should be left or right, and it is not tribes and territories or a jungle, but I think this is an opportunity for change and also to innovate, yeah, which we learned that I think the keywords is networking and collaborations, yeah. And to conclude, I would say that the change is consistently present, but COVID is huge, yeah, disrupt our lives, yeah. And higher educational leader has to be able to frame crisis and change in positive and open way, yeah. And we learned that good and intensive communication is important, and every person adapts to a change uniquely. And one thing that we have to understand and see that situation will not come to normal again. Let us learn together and celebrate success and acknowledge the shift to the new reality. Thank you very much.